Welcome. Today we're going to be looking at endocrine disorders, and under endocrine disorders, we're going to be looking at hypophysis, which are disorders of the pituitary gland. So straight up, we go to disorders of the pituitary gland. So hypophysis is considered as the master gland, as the hormones secreted are very vital for the proper development of functioning of the body. So these disorders are classified under hyper and hyposecretions of hormones and pituitary cancer leading to alterations of the structures of hormones. So the major disorders of the pituitary are acromegaly, diabetes insipidus, hyperpituitarism, and pituitary tumors. So we're going to look at acromegaly. And acromegaly is caused by excessive secretion of growth hormone, which is characterized by excessive growth in the form of swelling of hands, legs, and soft tissues. So the patient is going to present with the symptoms as indicated. So swelling of hands and feet, facial features become coarse as bones grow, protruding jaws, degenerating arthritis, and enlargement of the organs. Those are some of the symptoms that the patient is going to present with. So next, we're going to be going to diabetes insipidus. So this is caused due to insufficient production of antidiuretic hormone, which is characterized by excessive thirst and excretion of large amounts of severely diluted urine. So for patients with diabetes insipidus, symptomatically they're going to present with extreme thirst, blood vision, dehydration, extreme urination, fevers, vomiting, or diarrhea. So next we go to hypopituitarism, and hypopituitarism is deficiency of all anterior pituitary hormones and is more common than individual hormone deficiency. So here are some of the hormones like the luteinizing and follicle stimulating hormone, growth hormone, adrenocorticotropic hormone, thyroid stimulating hormone, prolactin, antidiuretic hormone, and oxytocin that get affected. And for the luteinizing hormone and follicle stimulating hormone, so women are going to experience infrequent menstrual periods and infertility, while men lose facial trunk hair as well as suffering decreased muscle mass and anemia, increased risk of osteoporosis. So for the growth hormone, so there's decrease in muscle mass, central obesity, impaired attention and memory. For children, they're going to experience growth retardation and short status. So for the adenocorticotropic hormone, so this is lack of production of glucocorticoids such as cortisol by the adrenal glands. So here the patient is going to present with fatigue, weight loss, delayed puberty in adolescence, hypoglycemia, which is low blood sugar levels, anemia, and hypernatremia, which is low sodium levels. So for the thyroid stimulating hormone, so the patient is going to have deficiency, which leads to hypothyroidism, which typically the symptoms are tiredness, intolerance to cold, constipation, weight gain, hair loss, low blood pressure. So for the prolactin, so it plays a role in breastfeeding, and inability to breastfeed may point out at abnormally low prolactin levels. So for the antidiuretic hormone, there's inability to concentrate the urine and also extreme thirst. For the oxytocin hormone, so deficiency generally causes few symptoms such as it only required during childbirth and breastfeeding. So it's not so easy to detect unless the mother is pregnant or lactating. So straight to go to the pituitary tumors, and the two most common pituitary tumors are pituitary adenomas, which are tumors that occur in the pituitary gland and account for about 15% of intracranial neoplasm. So On the diagram, you can be able to see where the mass is, and here we also have the prolactinomas, which are the most common types of pituitary tumors, and it secretes prolactin and acidophilic galactolinea and hypogonadism, anorexia, infertility, and impotence too. So those basically are disorders that affect the pituitary gland at lengthy. Thank you. Let's meet again.